We're going to move on now to our next item of business, which is a statement from the First Minister on COVID-19. The First Minister will take questions at the end of her statement. I would encourage all members who wish to ask a question to press their request to speak buttons. And I call on Nicola Sturgeon, the First Minister.
Thanks, Presiding Officer. 2 weeks ago, the Scottish Government published the new strategic approach to tackling COVID, and shortly afterwards we confirmed the level of restrictions that would apply initially to each local authority area. I indicated then that the allocation of levels would be reviewed on a weekly basis. Our intention, unless we consider more urgent action to be necessary, is to set out any changes on a Tuesday and for these changes to take effect the following Friday. Today is the first of these reviews, and I will shortly confirm the levels that will apply to each local authority area from Friday. However, I can confirm at the outset that the majority of local authorities will see no immediate change this week. I'll set out the rationale behind our decisions, and we are publishing on the Scottish Government website this afternoon detailed data for each local authority. Of course, it is important to be clear that these decisions always involve careful judgments as well as hard data. Firstly, though, I will report on today's statistics. The total number of positive cases reported yesterday was 832. That represents 9.5% of people newly tested and takes the total number of cases to 75,187. 293 of the cases were in Greater Glasgow and Clyde, 171 in Lanarkshire, 114 in Lothian and 90 in Ayrshire and Arran. The remaining cases were spread across the other 7 mainland health boards. 1,239 people are now in hospital, an increase of 12 from yesterday, and 102 people are in intensive care, which is 3 fewer than yesterday. I also deeply regret to say that in the past 24 hours, a further 39 deaths have been registered of patients who first tested positive over the previous 28 days. That means the total number of deaths under this measure is now 3,079. 2 weeks ago, that number was 2,726. Tomorrow's update from National Records of Scotland will give us a fuller picture of the number of deaths based on its wider definition. But even using today's figures, the fact that we have seen more than 300 people dying in the past 2 weeks is a sharp reminder of the heartbreak this virus causes and of why we must do all we can to tackle it. And once again, my deepest condolences go to all those who have lost a loved one. Presiding Officer, those who have lost someone or who are living with the long-term effects of COVID obviously carry the greatest burden of this virus. But I know everyone is finding the experience and the restrictions we are living under increasingly difficult. And I know the figures I report each day contribute to a sense that there is no light at the end of this tunnel. Throughout this pandemic, I've tried not to give false assurance. Instead, I've done my best to be straight about the challenge we face, and I'm going to stick with that approach, not least because, as will be obvious from my statement today, we do still face tough times ahead. But, and this is important, there are also grounds for optimism now. We're not at the end of the tunnel yet, but a glimmer of light has appeared. Yes, there will be dips in the road, and that means the light might be obscured at times, but it is very much there and we are heading towards it. Yesterday's news from the Pfizer vaccine trial was extremely encouraging. That's probably an understatement. And that, of course, is not the only vaccine undergoing trials just now. Of course, there are questions still to be answered and hurdles yet to be overcome, and it will take time practically and logistically to get large numbers of people vaccinated. But this was the most positive indication yet that science will get us out of this, and it will hopefully do so in the not too distant future. That is really good news. Of course, even the not too distant future is still the future. And that means for now, it is down to all of us to keep the virus under control and save lives by sticking to the rules and guidance. But here too, we have some cause for cautious optimism. The sacrifices everyone is making are hard and they feel never ending, but they are helping. They have made a difference and they are saving lives. I have no doubt about that, and no one should be in doubt about that. To illustrate that point, let me give some detail on one of the measures, just one of the measures we look at each week, the average number of new cases per day over a continuous 7-day period based on the day when each test sample was given. In just 3 weeks, between Friday 25th September and 16th October, Scotland's average daily figure for new cases increased by more than 150%. It rose from 482 to 1,217. If that scale of increase had continued, we would now have around 3,000 new cases a day. But instead, in the next 3-week period, the number of new cases stayed at more or less the same average daily level. So by last Friday, the average daily figure was 1,174. There have also been some signs of a fall in hospital admissions. In the 7 days to 30th of October, 725 people were admitted to hospital with COVID. In the 7 days to 6th November, just last Friday, 545 people were admitted. So the point I'm making is this: there is no doubt that the restrictions we have put in place and that people are abiding by have dramatically slowed the spread of the virus. But of course, that figure for hospital admissions, more than 500 in a week, is still too high. The number of new cases we are seeing, more than 1,000 a day on average, is also still too high. And this is crucial. While we have seen a levelling off, we are not yet seeing a sustained fall in cases. In fact, although there was a very slight fall in some recent weeks, last week we actually saw a slight increase. Clearly, that requires continued caution. As I've set out before, a rising or even plateauing rate of infection is not a stable position. We want to see a decline in cases. So we'll be monitoring the situation carefully in the days ahead, and we can't rule out the need to take action beyond what I will set out today. Also, in light of the situation I've just outlined, it would clearly not be prudent to ease restrictions today, with one exception for our 3 island authorities, which I'll set out shortly. However, I can confirm that no local authority will move down a level this week. In light of particularly sharp increases in cases, unfortunately 3 local authorities will move up from level 2 to level 3. And while no local authority, I'm pleased to say, will move to level 4 this week, there are a number that are giving us some cause for concern, and we'll be monitoring these particularly closely over the next few days. I'll come on to the detail of all of that in a moment, but let me firstly set out again the indicators and the wider factors that we consider in reaching these decisions. We look at data for each local authority on case numbers per 100,000 of the population, trends in case numbers, test positivity and hospital and intensive care capacity. We're publishing the data that has informed our decisions for each local authority today, and you can look at it on the Scottish Government website. We also consider the extent to which different local authority areas are contributing to the situation across the country as a whole and the links and interdependencies between them. And we seek to balance the wider health, economic and social harms caused by the restrictions in place. We consider the advice of public health directors through the National Incident Management Team and consult with local authorities. Then Cabinet, with advice from the Chief Medical Officer, National Clinical Director and others, balances all of these factors and reaches decisions. So let me turn now to the detail of the decisions reached by Cabinet this morning. Firstly, I can confirm that Highland, Moray, Orkney, Shetland and the Western Isles will remain at level 1. However, there must be no complacency in these areas. Restrictions still in place must be adhered to and all necessary precautions taken in workplaces, hospitality, schools and colleges and healthcare settings. There is one restriction that we do intend to ease for people living in Shetland, Orkney and the Western Isles. From Friday, residents of these 3 island authorities will be able to meet with one other household inside their homes up to a strict maximum of 6 people. We're able to make this change because case numbers in these island authorities are very low and sporadic, and we recognise that the social isolation caused by such a restriction is often exacerbated in island communities where there are not as many public places to meet. However, and this is an important caveat, importation of the virus is a real risk to the islands. For that reason, we will also be issuing clear guidance advising anyone who goes to or returns to the islands from the mainland to avoid in-house mixing for a period after their return. Unfortunately, we don't yet consider it prudent to lift this restriction for people in Highland and Moray, the other level 1 areas. Although cases in these areas remain relatively low, we have seen some volatility in recent days. So to people living across the Highlands and in Moray, as for people in the rest of the country, we continue to ask that you do not visit each other's homes except for essential purposes such as childcare, looking after a vulnerable person or being part of an extended household. I know this is tough, but it remains the single most effective way of preventing transmission of the virus from one household to another. Let me turn now to those areas currently in level 2. I can confirm that Aberdeenshire, Aberdeen City, the Borders, Dumfries and Galloway and Argyll and Bute will all remain at level 2. These are all areas that will be hopeful, as I am, of a move to level 1 soon. However, while there are some signs of stability and even improvement in most of them, there is not yet sufficient evidence of a sustained decline in the number of cases. Indeed, I have to point out that in the Borders and, although to a lesser extent in Dumfries and Galloway, we have seen an increase in cases in the most recent data that we have available. For these reasons, we consider it sensible for these areas to remain in level 2 for now, but we do remain hopeful that some or all of them will be able to move to level 1 soon. The other areas currently in level 2 are Fife, Perth and Kinross and Angus. And I can confirm that we have taken the very difficult, but in our view, necessary and precautionary decision to move Fife, Perth and Kinross and Angus to level 3 from Friday. While on the raw indicators alone, Angus and Perth and Kinross are not yet meeting the level 3 thresholds and Fife is meeting just one of them, all three areas are on a sharply rising trajectory. The most recent data shows that in the space of a week, the 7-day number of cases per 100,000 of the population has increased in Perth and Kinross by 32%, in Fife by 40% and in Angus by 47%. The advice of the Chief Medical Officer and National Clinical Director is that level 2 restrictions may well not be sufficient to slow down and reverse increases of this magnitude, and as a result, an early move to level 3 was strongly recommended. I know how disappointing this will be to residents and businesses in these three areas. However, and this is an important point, by acting now, we can hopefully prevent an even more serious deterioration in the situation in future. I would ask people living in these areas to check the Scottish Government website to understand the restrictions in place at level 3. Businesses will also find details there of the financial support available from the Scottish Government, which of course is in addition to the UK Government's furlough scheme. Now, a factor relevant to both Angus and Perth and Kinross is proximity to and interaction with the city of Dundee. Dundee entered level 3 on 2nd November and I can confirm that it will remain at level 3 for now. However, I hope the three authorities going into level 3 this week will take some encouragement from it. The most recent data shows cases and test positivity declining in the city of Dundee. And while it's too soon to be sure that this will be sustained, I want to stress that the trend is very much positive at this stage. I can also confirm that the other 18 local authorities currently at level 3 will remain there for now. However, it is important to note that there is a varied picture across the level 3 areas, and a move to level 4 for some in the near future cannot be ruled out for reasons that I will outline. However, firstly, on the positive side, some of the current level 3 areas are, like Dundee, showing encouraging signs. There is some volatility in the most recent data for some of these areas, but I would mention, with varying degrees of confidence, East Lothian, City of Edinburgh, Clackmannanshire, East Dumbartonshire, Falkirk, Midlothian, North Ayrshire and East Ayrshire. Obviously, we will monitor all of these areas carefully, but we hope that if people continue to abide by all of the restrictions, we will continue to see improvement, and some of these areas may be able to move out of level 3 relatively soon. However, there are two categories of level 3 areas that we will be considering particularly carefully over the next week. Firstly, there are areas where current restrictions have worked very effectively to halt sharp increases in cases and stabilise the situation. That includes, in particular, the City of Glasgow and North and South Lanarkshire, but also, I'd mention, West Lothian and West Dumbartonshire. And that stabilisation is really positive news. Don't lose sight of that. Without the sacrifices everyone has been making, the situation would be much more severe. However, while cases have stabilised in these areas, they have stabilised at a stubbornly high level. And I've set out previously the risks of going further into winter with a high level of cases, even if it has plateaued. So the difficult question we must consider in the next days is whether more time in level 3 will start to reduce cases in these areas, or whether that is going to require more action. And finally, there are some areas in level 3 where we are in recent days seeing a sharp rise in cases. I have to point out to the Chamber that right now we are particularly concerned about Inverclyde and Stirling, and to a lesser extent South Ayrshire, Renfrewshire and East Renfrewshire. The advice of the Chief Medical Officer and National Clinical Director is that since these areas are already in the tougher level 3 restrictions, and given the need to understand the situations in these areas in more detail, an immediate move to level 4 would not be merited. However, their advice is that we should monitor the data for these areas closely and on a daily basis. Presiding Officer, given the severity of the level 4 restrictions, we will not take a decision to move any part of the country to that level lightly. In addition, we want to give the current levels more chance to work. But nor will we shy away from doing that if we think it necessary to limit the damage the virus can do, or if we think a short period at level 4 may be less harmful overall for an area than a prolonged period at level 3. These are really difficult decisions, and I want to stress that the week ahead is a particularly crucial juncture, and of course I will keep Parliament fully updated. However, I want to stress this point. The best chance all of us have of avoiding a move to level 4, or indeed of moving our area down a level, is to stick with it and to abide by all of the current restrictions. I know fatigue is setting in and frustration is setting in too, but I appeal to everyone across the country, particularly if you might have been letting your guard drop recently. Please redouble your efforts in the days ahead. In particular, please do not visit other people's houses. That is the biggest risk of passing this virus from one household to another. We know, and we can show, I have done that to some extent today, that all of these hard sacrifices are making a difference. But the fact is, they will only make a big enough difference if all of us do all of the right things all of the time. That is tough, but it is the reality we face. Presiding Officer, finally, let me stress the travel restrictions that remain essential to a targeted approach to tackling the virus. These will remain in guidance over the next week, but we continue to prepare the regulations and resolve the practical issues that would be required to put them into law. We will not hesitate to do that if we think that is necessary. However, I appeal to people across the country to please abide by these travel restrictions now so that that doesn't become necessary. If you live in a level 3 council area, do not travel outside your own local authority area unless it is for essential purposes, such as work that can't be done at home, healthcare or caring responsibilities. You can find the full list of essential purposes on the Scottish Government website. And if you live elsewhere, don't travel into a level 3 area except for the same essential purposes. And please don't travel outside of Scotland to other parts of the UK or overseas right now unless it is for these essential purposes. Abiding by restrictions like these is hard. It's not a position any of us want to be in. But I can't stress enough that it is essential if we are to avoid spreading the virus from high prevalence areas to lower prevalence areas. Because if we do that, then those lower prevalence areas will end up being under tougher restrictions than otherwise necessary. Presiding Officer, there are many people across our country right now who are grieving the loss of a loved one, too many people. Many more have lost jobs or are right now worried about losing their jobs. And of course, some people are living with the long-term health effects of COVID. For these carrying the heaviest burden of this virus, words are, of course, little comfort. But for all of that, and for all the fatigue, frustration and apprehension that we all feel, let's not forget that glimmer of hope. The numbers I report for new cases, people in hospital and dying, remind us that this virus continues to exact a terrible toll. And looking around the world just now, it's easy to see that if we are not very careful, things could get worse. But against that, we can also see that the sacrifices we make do have an impact and are having an impact. And yesterday's announcement about a vaccine is the best news we've heard since the start of this pandemic. One of the points I've tried to stress in the past few months is that at some point this will all be over. At some point we will be looking back on it rather than living through it. Today, though tough times do still lie ahead, that seems a bit more real, a bit more graspable for all of us. Of course, it doesn't remove the need for caution. It will be over one day, hopefully soon, but it is not over yet. So this is not the time to let down our guard. Now is the time to do everything we can to look after and look out for each other. The more we can keep each other safe in the weeks and months ahead, the more we can look forward to brighter days in the spring. So please, now more than ever, stick to the rules in your area. Check the website to see what they are, and please remember facts. Wear face coverings, avoid places with crowds of people, clean your hands and hard surfaces regularly, keep 2 metres distance from people in other households, and self-isolate and get tested if you have any of the symptoms of COVID. If we all continue to do all of this, all of the time, we will protect ourselves, our loved ones and our NHS, and we will undoubtedly save lives. My thanks once again to everyone for sticking with it and sticking with each other.
Thank you very much, First Minister. The First Minister will now take questions. Ruth Davidson.
Thank you, Presiding Officer. Yesterday's announcement on the efficacy of a COVID vaccine, and one that the UK has pre-secured 40 million doses of, should give us all grounds for cautious optimism. But the promise of an effective vaccine at the turn of the year does not override the ability of each of us to play our part now. The ongoing restrictions we're all living under continue to be difficult for the individual and in many cases crippling for shops, bars, restaurants, businesses and jobs. The way out of this, for everyone, is not just to have an effective vaccine, it is to be able to deliver it to the population in an effective and timely manner. We already know from the Health Secretary that we won't be delivering these vaccines under the same model as used for this year's seasonal flu programme because, as she rightly says, lessons need to be learned. The simple question that people will want answered is how exactly will this be delivered? Reports over the weekend discussed large-scale venues such as medical hubs and conference centres being used. I'm sure people would find it helpful if the First Minister could today give us some confirmation whether she can identify these venues at this stage and whether they've been secured for this purpose. Returning to this year's seasonal flu vaccine, many of the problems we saw arose from removing administration from GPs and handing it to health boards. Some health boards coped admirably. In others, there were significant and chronic problems. Is the First Minister satisfied that a national rollout of COVID vaccinations sees all Scotland's 14 health boards start at the same level of readiness so that this potential game changer can be administered fairly and equitably across the country, no matter where you live?
First Minister.
Can I thank Ruth Davidson for those questions and reiterate the point that until we are at the point of vaccinating large numbers of people, of course, it is incumbent on all of us to keep the virus under control by abiding by all of the restrictions, however tough I know that is. The Health Secretary will, over the next period, set out much more detail of exactly how we will deploy the vaccine and the programme that will be in place to ensure that it is delivered to priority groups across the whole of the country. In short, yes, we are confident that health boards will be at a level of readiness to deliver that. There will be a nationally coordinated approach to that, although delivery will be health board led. There will be a number of places and premises, including local places and premises like pharmacies across the country, that will be part of that programme. We will set out more detail of that once that detail is finalised or is finalising over the next weeks. We are also following and will continue to follow the recommendations from the Joint Committee on Vaccination and Immunisation on the prioritisation for the vaccine. Interim recommendations have been given. They were published by the UK Government yesterday, although they may be subject to change once the final properties of this vaccine and any other vaccines become more known. This is going to be one of the biggest vaccination programmes that we have ever undertaken. It will certainly be on a par to flu, although on the basis of the Pfizer vaccine, we would expect that people will need 2 doses 3 weeks apart. So there are even more complicated logistics involved in this. The Health Secretary is overseeing this on, I'm pretty sure, a daily basis, as am I, and we will make sure those details are set out as they develop and finalise to Parliament over the next few weeks. But let's not lose sight of the fact that this is good news. I don't want to underplay the questions that are still to be answered about the efficacy of the vaccine, the prioritisation of it, how much immunity it might confer. The scientists are working hard on all of this. But I think for the first time in 7 months, we do have that very distinctive light at the end of the tunnel. And hope's been in short supply over these past few months, so I think we should all enjoy it while we can.
Richard Leonard, followed by Alison Johnson. Richard Leonard.
Thank you, Presiding Officer, and can I thank the First Minister for advance sight of her statement. We all appreciate the balancing act needed between the harms of the virus and the wider damage inflicted by the restrictions themselves. Damage to businesses, damage to jobs, and the rising isolation, anxiety and loneliness of many across Scotland. Huge sacrifices are being made. The First Minister, in setting out the new framework only 12 days ago, said that, I quote, "Our aim is that the restrictions should be in place for as short a time as possible." But today, not one local authority area has been moved to a lower tier, and the whole of Fife, Perth and Kinross and Angus are being moved up to level 3 from Friday. All the evidence must be shared, and it must be persuasive. The purpose of the new strategic framework was to provide clarity and transparency in the government's decisions. But the announcement today raises more questions, not least about what it will take for communities to move down a tier. So what will it take? And why it is that the First Minister, after 8 months, is now contemplating the serious measure of applying the force of law to travel restrictions.
First Minister.
On that last point, we've never ruled that out over the past 7 months, but we have always encouraged across all of these measures voluntary compliance, because I believe, and our behavioural science advisors would, I think, back this up, that it is better to encourage and support people to do the right thing rather than use the force of law when they do the wrong thing. But we will not rule out, and haven't ruled out, and in fact have moved to a legal position on things like face coverings, and I think that is the responsible approach for any government to take. On the question of the different harms, obviously the virus does harm directly, and the way in which we tackle the virus does harm as well. But I think it is important for all of us to recognise that if we don't tackle the harm of the virus, then we exacerbate the other harms. We don't minimise them. I think there is, understandably, because everybody is frustrated and people are worried about jobs and businesses, a sense that if we just ease up on the restrictions to tackle the virus, then the economic harm won't happen. That is a fallacy. If we allow the virus to run out of control, the harm on the economy will be worse. But of course, we need to make sure support is in place while we do that, and we have put support packages in place. On the evidence, we will publish, it probably is published already, for every single local authority, a page of the most up-to-date data showing the direction of travel, cases per 100,000. You know, there is a wealth of data there that people can go and look at. But, you know, some pieces of data, it really can't be denied. If you look at Fife and Angus and Perth and Kinross, the figures I've just given of, you know, 40% or thereabouts increases in cases in the space of a week, no responsible government can ignore that, and acting early hopefully stops a greater deterioration. Yes, I would like to be in a position where we're moving local authorities down a level today. I would love to. But I am also in a position where, unlike other parts of the UK, and I don't mean this pejoratively, and we can't rule anything out for Scotland, but unlike other parts of the UK right now, we're also not in a full national lockdown. So we are making some progress, but this is an accelerating global pandemic. And therefore, it is really important for all of us to be frank about the challenges we still face and the hard actions we have to take to make sure we keep it under control. And that's what the levels are intended to do, and that's what the weekly reviews and being prepared to change course when necessary are prepared to do as well. Finally, on when areas move up or move down, the broad indicators are set out. They were set out last week. They can be looked at on the website. But of course, around that, we apply judgment. So in Fife, Angus, Perth and Kinross, we've applied judgment that if we waited to next week until they might meet the raw indicators, the situation would have run more out of control. So by acting this week, hopefully we can get it under control more quickly. And that's where judgment has to combine with the hard data to reach these conclusions.
Alison Johnson, to be followed by Willie Rennie.
Thank you. According to an article published by The Guardian, and indeed other papers, a proposed move to cut the self-isolation period from 14 to 10 days is the result of a disagreement between Chief Advisor to the Prime Minister, Dominic Cummings, and Professor Chris Whitty. The specified 10-day period is apparently a compromise between the CMO and Mr Cummings, who pushed for an even shorter isolation period. So I'm sure the First Minister will agree with me that Dominic Cummings is the last person we should listen to when it comes to self-isolation. But he is a reminder that compliance with this crucial measure is still an issue. So can the First Minister confirm that Scotland will not support this move? Can she tell us what proportion of those asked to self-isolate comply and what further actions her government can take to enable, support and increase self-isolation where it's required? Thank you.
First Minister.
So I have no advice at the moment to reduce the periods of self-isolation below what they are right now. I will always listen to clinical and scientific advice, so I cannot stand here and say that I will never get advice of that nature, and I will consider it carefully if I do. But it certainly won't be advice from Dominic Cumming. I hope that reassures Alison Johnson. But we will always consider that carefully. But as of now, let me be clear, we are not planning and have no plans to reduce the periods of self-isolation, because they, as they are right now, are based on the most up-to-date advice that we have. We are doing work to try to understand more the levels of compliance with self-isolation, and we, as Alison Johnson and others will be aware, there is now a proactive service in the start for people on low incomes, where local authorities reach out to people self-isolating. That will be one way of assessing compliance, but we are looking at other ways where we can monitor that going forward, and I'll keep Parliament updated on that. The self-isolation payment, I don't have figures in front of me right now, but we will publish the up-to-date figures on uptake of the self-isolation payment as soon as we are able to do that. But we are currently and actively looking at what else we can do over and above the payment, either through additional financial support or other practical measures to support people to self-isolate, because Alison Johnson is right, it remains not the only, but one of the most important things anybody can do. If you have symptoms, then you should self-isolate immediately and get tested. And if you're a close contact of somebody who tests positive, it is absolutely vital that you self-isolate. And the more we can do to support people with that, the more we will encourage higher compliance. So these are all matters under active consideration, and we'll keep Parliament updated.
Willie Rennie to be followed by Ruth Maguire.
Fife will want to know what we've got wrong and what we need to do to get back to level 2. Over the last few months and in other areas of Scotland, the First Minister has been able to say it's been pubs or indoor social gatherings. So what data is available from testing and tracing about the spread and the cause of the spread in Fife, as well as Angus and Perth and Kinross? The First Minister knows I am frustrated about the Scottish Government's slow pace of progress on testing. If they are testing all students in England for Christmas, what is stopping the First Minister doing the same for students in Scotland?
First Minister.
The only thing stopping me right now is the need to advise Parliament first, which the presiding officer I'm sure would insist on, and of course the Higher Education Minister will make a statement to Parliament tomorrow, setting out plans on that, and I am sure Willie Rennie will be heartened and encouraged by what he hears in that statement. We have a supply of what are called lateral flow testing devices. We are currently looking at the logistics of exactly how and the clinical prioritisation of using these, but without preempting the statement that will be made tomorrow, students will clearly be a priority for that. So I hope Willie Rennie will be happy when he hears Richard Lockhead's statement tomorrow. Can I say to Willie Rennie, I think we've got to be really careful, and I mean this genuinely, to use language like, what has Fife done wrong? This is an infectious virus in a global pandemic. With the best will in the world, sometimes people get it and sometimes people transmit it, and sometimes it can run out of control for a period. I think we've got to be careful about language that suggests people are to blame for that. However, it is important that we make very clear that all of us, through our individual actions, can help minimise that. We can't guarantee we won't get it, we can't guarantee we won't pass it on, but by following the facts advice, by abiding by all restrictions, we can minimise the chances. There will be, the situation in Fife right now, it has accelerated quite quickly. The figure I gave earlier on is that over the past week, and these are figures going up to the 6th of November, there's been a 40% increase in the cases per 100,000 of population. Over the same period, the positivity test rate has gone up by 1.5%. We have a rising projection for hospital and ICU admissions, although we are not at the moment seeing these being breached in Fife. There is not yet an absolutely clear understanding of exactly what the drivers of that might be, although the information that comes out of Test and Protect suggesting the contacts people have had in the 7 days before testing positive will be looked at in order to try to inform the local response to this. That is information that is provided through Test and Protect Public Health Scotland reports, but some of the information that I have set out just in the last few minutes is published today, and all members can go and look at it. And the hope is with Fife, with Perth and Kinross and with Angus acting quickly here, as we have reason to believe might be happening in Dundee, will bring this under control and lead to these areas being in tougher restrictions for a shorter period than might be the case if we waited and it ran further out of control.
Thank you. Ruth Maguire to be followed by Maurice Golden.
Thank you. It's positive to note that measures in place in Scotland are starting to have the intended effect, and I appreciate the vast majority of the public understand the need for caution, particularly in light of increasing cases across the world. Presiding Officer, I've had a number of constituents with caring responsibilities contact me about advice not to travel outside your own local authority area, except for essential purposes. Would the First Minister take this opportunity to reassure them that taking care of loved ones is considered essential, and perhaps outline what other exceptions to the travel guidance there are?
First Minister.
I understand people's anxieties over this. Let me reiterate that these travel restrictions are necessary to stop taking the virus from high prevalence areas to low prevalence areas, and that is vital if we are to maintain a differentiated approach to restrictions. But there are exemptions to that for essential purposes, and the exemptions are set out in the guidance which is available on the Scottish Government website. But the kind of things would be to care for a vulnerable person, if you have to deliver food or other care to somebody who's old or vulnerable, if you have childcare reasons for travel, if you have to travel because of where you live, a reasonable distance, perhaps a few miles outside your own local authority for exercise, or if you have to do the same for essential shopping, if you cannot do that within the area you live in. These are the kind of exemptions that exist. But we are asking people where possible, and unless it is absolutely essential, to abide by these restrictions, because it will help us stem the increase in cases. Ruth Maguire, this information is available, but Ruth Maguire's own constituency area, North Ayrshire, of course, is one of the areas where we are seeing some cautious signs for optimism. I mentioned a moment ago in Fife a 40% increase in the most recent 7 days. In North Ayrshire, that is a 12% decline in cases. Now, we have to wait to see if that is going to be sustainable, but it is one of the positive signs we're seeing right now, and it's down to the sacrifices people across North Ayrshire and elsewhere in Scotland are making.
Maurice Golden to be followed by Bruce Crawford.
Thank you, Presiding Officer. The Scottish Tourism Alliance has warned the sector faces a third winter. There is funding available to the SNP to offer help if they choose to, £500 million unspent in their autumn budget revision, in addition to the UK Government providing Scotland with a £1.7 billion boost. So can the First Minister confirm how much of this will be spent protecting jobs and supporting Scottish businesses?
First Minister.
Firstly, let me make an important point, because I understand how difficult this is for businesses, and it's a point that has been recognised by the UK Government in the action they have taken through the lockdown currently in place in England, that if we don't control the virus, we do more damage to the economy in the medium to long term. And I know that is difficult for businesses that are struggling right now, but that is the reality. That's why the steps we're taking to control the virus are right for health and lives, but also ultimately right for the economy. We will invest every penny we can in supporting businesses. In addition to the UK Furlough scheme, we already have a package of business grant support, and businesses can find detail of that again on the Scottish Government website, and that is administered through local authorities. We are also considering, over and above that, for particular sectors, what additional support we can provide, and we will set out details of that as quickly as possible. But there will be no penny that is available to us for this purpose left unspent, because it's vital when we are asking businesses to do unprecedented things that the governments across the UK give them, as far as possible, unprecedented support.
Bruce Crawford, who joined us remotely, to be followed by Monica Lennon. Bruce Crawford.
Thank you very much, Presiding Officer. First Minister, I know that you are aware that this current restrictions are having a huge impact on the hospitality sector in my constituency of Stirling. Unlike the Tories, I recognise that the Scottish Government's on a fixed budget, how difficult it is to find additional finance to support the sector. That being said, can I ask the First Minister what further can be done to support small to medium-sized hotels and guest houses, with restaurants in particular? And if that requires further support from the UK Treasury, then they should provide that. I know from experience on the ground that such businesses are desperate, and where they're required to close or because restrictions mean trading conditions are simply impossible, some will never reopen again. As a son of a hotelier, this sector is a sector close to my heart, and I feel deeply for them. So what can the Scottish Government do to help?
First Minister.
I very much share the member's concerns, and indeed the concerns of the member who previously asked the question with regard to the hotel sector and tourism and hospitality more widely. As Bruce Crawford will be aware, we've already provided £14 million through our Hotel Recovery Fund, a further £4 million for B&Bs and self-catering accommodation within a wider package of support, which now totals over £2.3 billion. We know that more needs to be done, though, to protect jobs and businesses into the future. The independent recommendations of the Tourism Recovery Task Force have now been published, and these will be considered by the Scottish Government and also by the UK Government, and that includes the recommendation to provide proportionate, fair financial compensation arrangements if further lockdowns are required. And again, the Tourism Minister will keep Parliament updated. Given that Bruce Crawford has asked a question and he, of course, represents Stirling, let me take the opportunity to underline a point I made in my statement, that Stirling is one of the the areas currently in level 3 where we have a significant concern about a sharply rising number of cases, and therefore it is going to be really important that people across Stirling redouble their efforts to stick to all of the restrictions to try to get that under control and avoid any potential move into the higher level of restrictions. And I know Bruce Crawford will be instrumental in encouraging his constituents to do so.
Thank you. Monica Lennon, to be followed by Annabel Ewing.
Thank you, Presiding Officer. On the glimmer of hope that is the COVID vaccine, what reassurance can the First Minister give that the public rollout of the vaccine will get underway as soon as it becomes available in Scotland? And to that end, because people have been raising questions, can she say in relation to cold storage and the supply chain around that, can she advise if we currently have any freezers that are capable of ultra cold temperatures such as the Pfizer vaccine, which requires -80°C, have freezers of that nature been procured, and if not, is work underway to do so?
First Minister.
Yes, we have purchased fridges, if I can use probably a completely untechnical term here, with apologies if I'm getting the figure wrong, because I've got so many figures going around my head on a daily basis, but I think from memory we have purchased around 20 of these very large fridges that are capable of storing the vaccine at those very, very low temperatures. Now, they will be situated in strategic locations across the country. There are then logistical issues in terms of getting the vaccines from the cold storage to where they need to be, and there are different temperatures that apply for short periods of time in that journey to the person being vaccinated. But all of these things are under very close and active consideration and deployment right now, including, I am pleased to say, the procurement of big fridges.
Annabel Ewing, to be followed by Rachel Hamilton. Annabel Ewing.
Thank you, Presiding Officer. I do not think it will come as a huge surprise to many of my constituents, or indeed to people across Fife, that Fife is being placed in level 3, given the significant increases in the numbers of COVID cases and indeed in admissions to ICU. Can the First Minister provide a bit more detail as to the decision-making process that was undertaken as far specifically as Fife is concerned? And can she provide assurances that the worrying increase in ICU admissions is being monitored closely? Thank you.
First Minister.
Yes, I can. But before I come on to the issue of ICU in particular, just let me very briefly go through some of the process. We've been identifying a rise in cases in Fife for a number of days, and during this weekly review process, the National Incident Management Team paid particular attention to the situation in Fife, and one of the reasons for that, as well as the rise in cases, was that ICU capacity has been a cause for concern. The figures for both incidence and test positivity have deteriorated, and also, and this is crucial to our decision to act early, the trend data suggests that without action, a further deterioration would be likely. So it's against that background that the National IMT advised moving Fife to level 3. That proposal was endorsed by Chief Advisors and the 4 Harms Group, noting that the local authority leadership had indicated that they understood the reasons for the need to follow public health advice. We're closely monitoring ICU admissions in Fife. Discussions continue to ensure that the NHS in Fife and elsewhere can cope with any increase in cases. Of course, there is the ability across the NHS and all health boards to double ICU capacity and, if necessary, to triple ICU capacity. So right now, we are not projecting that Fife will breach certainly not breach its doubled ICU capacity, and if these additional restrictions have the effect that we want them to, then we should see that position improve even further. But let me assure Annabel Ewing that this will be something that is closely monitored in the days to come.
Rachel Hamilton, to be followed by Bob Doris.
Thank you, Presiding Officer. The First Minister will be aware that vitamin D is especially important in Scotland because Scots are at above average risk of deficiency, particularly in winter. Is the First Minister confident that the current supply of vitamin D to people shielding is sufficient? And will she answer campaigners' calls to extend the vitamin D scheme to care home residents in Scotland, as has been announced in England?
First Minister.
So supply of vitamin D has been challenged in recent months throughout the pandemic, but we are now in a position, and I think the text messages to people in the shielding category went out yesterday or in the last couple of days. We will be offering a 4-month supply of vitamin D to anybody who wants it in the shielded category. Of course, they also have to have advice about potential contraindications if they are taking other medication as well. The situation in care homes, which we are looking at right now in terms of whether we need to make any changes, and obviously supply will be a factor that we need to take account of. But the situation right now is that care home residents can, if they are clinically advised, access vitamin D. But the reason up until now that it has been based on clinical advice is to guard against contraindications with other medication they're taking. But we are currently looking to see whether we want to change that position in any way and make it available more on a par with those not in care homes in the shielded category. But right now, anybody in a care home who is deemed to benefit from vitamin D is able to get it.
Bob Doris, to be followed by Daniel Johnson.
Presiding Officer, we all know that the restrictions confirmed again today have a major economic impact, and due to the uncertainty caused by the UK Government's failure to extend furlough scheme until the very last moment, many employers have already made a difficult decision to make people redundant. However, it's important to stress employers can bring back people who have been made redundant and re-furlough them. Would the First Minister join me in encouraging employers, including a major theatre company group in Glasgow and actually across the UK that's been drawn to my attention, to urgently work to bring back any employees who have recently been made redundant in order to ensure they receive the support they deserve during the ongoing restrictions?
First Minister.
Well, although the extension of furlough is very welcome, I think, as was commented upon last week, it is regrettable that it came so late in the day where many businesses had already made people redundant, and many businesses, or some businesses, had probably decided to close businesses as a result of the uncertainty, or what appeared to be certainty, that furlough was not going to continue on the terms that it now is. I would encourage any business in that position to consider bringing staff back, to take advantage of all of the support that is available. Obviously, I can't make decisions for every businesses, but the Scottish Government will try to offer whatever support we can to help businesses in those circumstances. And if Bob Doris wants to give us more detail of the situation in this constituency that he's referring to, we can certainly look to see whether there is further support we can make available.
Daniel Johnson, to be followed by Maureen Watt.
When the levels were first set on 4 out of the 5 measures, Edinburgh merited being placed in level 2. Despite improvement, the city remains at level 3, and many may ask why. Now, I understand these are judgments, not simple arithmetic, but in turn I think that requires greater explanation and transparency. So can I ask the First Minister to provide a full minute or report for the decision for each local authority to be published, including on the basis of the judgments that have been made, by whom and on what advice? And can I also ask for briefings to be provided to all elected members when level decisions are made, including councillors, as having spoken to councillor colleagues in Edinburgh, they are far from clear on the basis for these decisions?
First Minister.
Well, Cabinet makes the decisions. Let me be very clear about that. We do that after taking account of a range of advice from Chief Medical Officer, National Clinical Director, the National Incident Management Team, the 4 Harms Group. There is consultation with local authorities. The Deputy First Minister spoke to City of Edinburgh Council yesterday and had a discussion about the most up-to-date data we have published. I appreciate members may not have had the opportunity to see it yet. A page of data for every local authority. And I think most people, when they look at all of the local authorities, will see the reasons why we have arrived at the decisions we've arrived at. So Daniel Johnson says more explanation is needed in Edinburgh. So if I can say on cases per 100,000 in the most recent 7 days, the change in Edinburgh has been 0, so that it hasn't gone up, but it hasn't gone down. Before we could be confident about moving Edinburgh down a level with the significant opening up that would entail, we would want to see a reduction in cases, and we are hopeful that Edinburgh will see that in the weeks ahead. On test positivity in the last 7 days, the test positivity has actually marginally increased by 0.2%. So there is, that's marginal, but again, it is not showing us a sustained decline. So all of this data is published, and ultimately judgments have to be applied to it. We are in a precarious situation with an infectious virus. Moving an area down a level is not a neutral act. It involves an opening up, and an opening up involves greater transmission opportunities for the virus. So we have to be clear before we do that, that the authority concerned, the area concerned, has, if you like, the headroom to cope with that increased transmission. I hope that will be the case for the City of Edinburgh in the not too distant future, but on the figures we have right now, it would not be a prudent thing to do right now. Instead, it could run the risk of sending Edinburgh in the wrong direction.
Maureen Watt, to be followed by Jamie Green.
Thank you, Presiding Officer. First Minister, from Test and Protect, there's now much more information about where the virus is more likely to be contracted and spread. Can the First Minister confirm that the information gleaned from Test and Protect will be used when deciding which sectors can reopen, and that those sectors such as gyms and beauty salons, etc., can know if they have in the main been overwhelmingly safe or not?
First Minister.
Well, this is similar to part of Willie Rennie's question, and I want to be very clear about the benefit of the information, the value of the information we get from Test and Protect, but also be straight with people about the limitations of it as well. So we look very carefully at the information that comes out of Test and Protect. Effectively, what happens when somebody is tested positive, a contact tracer interviews them and asks them where they've been in the 7 days before they had the onset of symptoms. And that will tell you whether somebody has been in a pub or a restaurant, whether they've been to work, whether they've been visiting a family member, whether they've been to the hairdressers or a beauty salon. And that is valuable information because it allows us, it will also tell you whether somebody's travelled somewhere outside of Scotland or within Scotland. That allows us to build a picture and draw conclusions about the types of venues and premises that may be featuring more often than others. And at an earlier stage, that allowed us to say that pubs were, we thought, a higher risk of transmission, as well as the scientific evidence that would point to that as well. The limitation, to be frank, is that that information does not tell you absolutely where somebody got the virus. So because somebody was in a pub 2 days before they had symptoms, doesn't mean that's where they got the virus. Genomic sequencing is required to get that level of information, and Scotland is doing a lot of genomic sequencing, which is very valuable. So we need to use this information, we need to use it sensibly, we need to understand its limitations, we need to help it, let it help us build pictures, and then we need to apply judgment to all of that. And in all of this, suppressing the virus is what we are seeking to do to allow greater opening up of the economy and society. If we don't suppress the virus, the hard reality is it gets harder, not easier, to open up, and that's not the position any of us want to be in.
Jamie Green, to be followed by Willie Coffey.
Thank you. Presiding Officer, COVID has undeniably impacted those from Scotland's poorest communities the most. We now know that the percentage of pupils from deprived communities off school for COVID-related reasons is double that of wealthier areas. On top of that, the gap in overall attendance between these two groups is greater than in previous years. So can I ask the First Minister what she thinks is behind this growing gap, what the Government is doing to address it, and will the Government support our proposals for a national tutoring programme to ensure that these pupils who need extra help and support can access it no matter where they live in the country?
First Minister.
We'll consider all practical suggestions that are made. We're also providing a lot of support for children in low-income families, free school meals during the holidays, which I'm delighted to say the Conservatives now appear to agree with. We have just opened applications for the Scottish Child Payment. We have the Best Start Grant. We have increased funding for the Welfare Fund. So in a whole range of ways, we're trying to provide targeted support where it is needed. There will be a number of reasons why the differentials in attendance figures at schools are as they are, and we look at that carefully. We look at attendance figures at schools on a daily basis, and the Deputy First Minister in particular pays close attention to them. Fundamentally, the most important thing is to take all of the necessary steps to support children to be at school and to support our schools to stay open for as long as possible throughout this pandemic, and that's what we are very focused on. And where we think there is a need to have additional measures in place to support that, or indeed provide additional help, we will always consider doing so.
Willie Coffey to be followed by Claire Baker.
Thanks, Presiding Officer. My question on vaccines has been covered, so instead, as a follow-up to Bruce Crawford earlier, could the First Minister please say something about the 6 p.m. restriction applying to restaurants in our level 3 areas? They're still losing all of their early evening dinner trade, and the relaxation recently hasn't really altered that very much, to be honest. Would the Government give some consideration to extending this to 8 p.m. perhaps, as it would make a huge difference to their ability to get through this, but still, of course, with the no alcohol rule in force?
First Minister.
We will always consider these things, and we will consider them on an ongoing basis as the virus develops. We will look to open up and ease restrictions where we can. But there are some really hard judgments and trade-offs at the heart of this, and it doesn't do anybody any favours for me to shy away from being open about what they are. The issue around no alcohol is, of course, to try and remove the disinhibiting effects that alcohol can have and make it more difficult for people to socially distance. But the restrictions on hours are hard and not welcome for anybody, particularly businesses, but they are important as well, because we can't lose sight of the fact that one of the things we're trying to do is limit the numbers of people that come together, particularly indoors, and interact. This is a virus that thrives on passing from person to person, household to household. It does that more successfully indoors in places where there is poorer ventilation and where people might be less likely to observe social distancing. We know that people's own houses are at significant risk, but so too are pubs and restaurants. So the hours are not just about the not having alcohol, it's also about trying to strike a balance between allowing businesses, some businesses, to trade to some extent, but also limiting the numbers of people that are coming together and interacting. It's really tough, but it is necessary. As I think all of the figures that I'm sharing with people today demonstrate, it's really necessary to continue to do that if we're to stop this virus running out of control again.
Claire Baker to be followed by Sandra White. Claire Baker joins us remotely.
Thank you, Presiding Officer. I would like to seek some clarity. I did look on the Scottish Government website to look for business support, and I understand that the Coronavirus Restrictions Fund closed to applications on the 3rd of November. Perth and Kinross and Fife have both moved from Tier 2 to Tier 3. So I'd like to ask how businesses will be able to access the higher level of support that comes along with Tier 3.
First Minister.
The support that's been available, the grant support, there are two levels of grant, for one for businesses that have closed and one where trading is restricted will be available to any businesses on an ongoing basis. There was the temporary measures for the temporary restrictions. That's now been replaced by ongoing support. I will make sure that somebody sends an email later this afternoon to Claire Baker about exactly where that information can be found and what exactly the process businesses in the areas newly going into level 3 have to do in order to access the support. But the support is there for businesses who either have to close or will have their trade-in restricted.
Sandra White, to be followed by Annie Wells.
Thank you very much, Presiding Officer. First Minister, you just mentioned a couple of minutes ago the Scottish child payment which opened for applications yesterday. I really believe it will be a game changer to help lift thousands of kids out of poverty in Scotland. Can I ask how much families with young children may receive or could receive if they apply for the Scottish child payment together with the 3 Best Start grant payments and Best Start foods?
First Minister.
Well, I'm very pleased to say that the Scottish Child Payment, which is the newest and biggest benefit so far under our new benefit system, opened for applications yesterday. Scotland is the only part of the UK where this additional payment for families with young children will be available, and it is a significant anti-poverty measure. The new benefit will give eligible families on low incomes with children under 6 initially, ultimately children up to 16, an extra £10 per week for each child, and the Scottish Child Payment, taken together with the Best Start grant and Best Start foods, will provide over £5,200 of financial support for families by the time their first child turns 6. For second and subsequent children, that will provide over £4,900. So this is significant support for families who most need it, and I would encourage anybody who thinks they might be eligible to make an application and make sure that if you are eligible, you get this support.
Annie Wells, to be followed by Stuart McMillan.
Thank you, Presiding Officer. The Government's winter plan stated some resumed services may have to be paused again should we need to create more capacity to deal with COVID-19 resurgence or manage other winter pressures. This appears to be already happening, with several health boards recently announcing the cancellation of non-urgent elective procedures and the warnings of bed shortages. It is vital that the NHS is not plunged into crisis this winter. So can I ask, what is the current available bed capacity in the NHS and how many of these beds are staffed?
First Minister.
I think, broadly speaking, and if I'm getting this number not exactly correct, I'll be corrected later, but around 13,000 bed capacity in the NHS, and we have a contingency within that for COVID. It is absolutely, at the start of the pandemic, of course, we paused all, apart from necessary and life-saving treatment, we paused elective treatment to ensure that that capacity was there for COVID. We do not want to do that again. There will be pressures at given times which interrupt elective and planned procedures, but the absolute priority here is to keep the virus under control so that the NHS can cope with COVID and treat patients who have COVID, but also treat patients who need it for other reasons. And that is one of the main reasons that these restrictions are so important, and why I know, and it is understandable and it's entirely legitimate, that people will press for relaxation here or there for this sector or that sector, and I get all of that. I make no complaint about that. But the reason we have to make sure we take the necessary action to stop the virus running out of control is to save lives, stop people becoming ill, but ultimately as well make sure that we protect the capacity of the NHS over the winter, when even when we don't have a pandemic situation, the pressures on it are greater than they are at other points of the year. And that is the purpose of the winter plan that the Health Secretary has already spoken about.
Stuart McMillan, to be followed by Alec Rowley.
Thank you, Presiding Officer. Sadly, there has been a significant increase in cases in Inverclyde in the last week. And can the First Minister commit to continuing to work with Inverclyde to seek to keep cases of COVID down, and also remaining engaged with the local community and also the local authority if Inverclyde is at risk of more restrictions?
First Minister.
I absolutely commit to continuing to work with Inverclyde, with the local authority there, with the public health authorities, to make sure we're doing everything we can to get cases down. The increase we've seen in Inverclyde in the last 7 days is very significant. It is more than 100%, and that obviously has to be taken very seriously. There's been a 2%, 2.1% increase in test positivity. I know that when we didn't put Inverclyde into level 2, when we first set the allocations, there were people in Inverclyde, understandably at the time looking at the data, who questioned that. I think the experience since then probably suggests that was the right thing to do. But we need to make sure, if we are to avoid tougher restrictions for Inverclyde, that we all work together to make sure the current restrictions are being adhered to and the authorities locally are working in as targeted a way as possible to get this transmission down. And what we know from other parts of the country is when that happens, it can be done. And I hope Inverclyde and the people of Inverclyde take some encouragement from that.
And Alec Rowley.
Thank you, Presiding Officer. Well, the announcement yesterday on the vaccine was very welcome. Does the First Minister acknowledge that there is a danger that that causes people to take their eye off the ball in terms of the spread of this virus? I welcome, I think, the announcement that's going to be made tomorrow in universities, although European universities have been carrying out mass testing for many months and haven't seen the kind of problems we've seen. And specifically to what's happening in Liverpool with the UK government and being talked about being rolled out elsewhere in terms of mass testing, is that something that the Scottish Government's looking at? And what's your view in terms of seeing mass testing, particularly in those areas in the west of Scotland that are being impacted worse?
First Minister.
So we are considering all of these things in short. Obviously, students, given the looming Christmas period, are a priority. Health workers, I think Parliament will also debate tomorrow, another priority. And then using testing, whether it is current PCR testing or new testing technology like lateral flow tactically in outbreak or high prevalence areas is also under consideration. There are some logistical, practical, clinical issues that we have to consider around all of this. The procured supply of some of these devices, the ways in which they can be used most effectively. There is a lower sensitivity, I think, not specific about how specific they are, it's about how sensitive they are, lower than PCR. So in some cases where they're being used, they have to be used more than once in a short space of time, and where people test positive, obviously, often they require to be followed up with a PCR test to confirm that positive. So these are the things we're working through right now. We'll set out the first steps in that around students tomorrow and keep Parliament updated more generally. Finally, on the vaccine, you know, like most people in my position, I've had to deliver so much bad news over the past 7 months. Forgive me if I've enjoyed the ability to be a bit more positive over the past 24 hours. But of course, there's a long way to go, and I think we all have to be open-eyed about this. But it is good news, and probably, as I said, the best news we've had. But if there is a risk to it, it's that people sit back and say, well, we can just wait for the vaccine and we don't have to bother with the restrictions anymore. That is not the case. We have to right now make sure we stick with all of these restrictions. Frankly, to make sure that by the time we get, hopefully to the spring, and the vaccine is helping us come out the other end of this, we get to that stage with as few lives lost as possible, with as little ill health as possible, and with the burden of COVID being as minimal as we can possibly make it. And that takes all of us continuing to do all of the right things all of the time at the moment.
Thank you very much. And I'm afraid, apologies to members who couldn't call, but we have to end proceedings there. We're going to move on to the next item of business shortly. A short pause.